It's a very sophisticated unit, very specialized unit, taking care of the very intense pulmonary patients. The unit is designed to rehabilitate the patients. Two main goals. One, if they come here on a mechanical ventilator, a life support machine, is to what we call wean them off the ventilator and then take care of all their other needs. And those other needs are physical therapy, occupational therapy, nutritional, wound care, speech, nursing, and social service. These are patients that come from the intensive care units that are still very chronically, critically ill. That's the terminology we use now. Not just critically ill, but they're now chronically critically ill. Not only do they have pulmonary diseases, they have multi-organ dysfunction. A lot of that dysfunction is physical therapy abnormalities, occupational therapy abnormalities, and of course psychological. So why don't we just stretch the time off the ventilator and not put them back on unless there's an absolute reason. We will have a team meeting with the family members. All of the family members will discuss what is the patient's outcome, what are the goals for the patient, what are the goals for the family, and of course the discharge planning. And the first protocol is we take them off the machine completely. We see how they breathe on their own. Once we see if they can breathe on their own, then we can make a decision to continue them off that machine. Now, if they don't do well, then we go back on the machine and we start over and we say, well, why did they not come off the machine? Was it a pulmonary problem? Was it a cardiac problem? Was it a nutritional problem? That we start over, and we may do this twice, maybe up to 3 times a day to try to get them off the machine. And maybe 1 or 2 days, depending how they do. The next goal would be taking the tracheostomy tube out. Now, when they're doing that, physical therapy, occupational therapy, wound care, nutrition, speech, nursing, social service, that whole team will be working on that patient. So good morning, Mr. Hahn. It depends. Some of them come here and we have them off the ventilator in 1 or 2 days. It's amazing, and it's the team. I must reiterate, it's the team approach. It's starting from day one, all the people involved, and that's what makes the difference in getting these patients off these machines.